Hi, and welcome back to Times Square today. I'm your host, Greg Roulette, and right now I am joined by a very special guest, Dr. Nicola Brown, who is the best-selling author and the CEO of Ayres Global, one of the world's most innovative healthcare and wellness providers today. Welcome to Times Square today.
Thank you so much.
I'm really excited to talk to you. We're a beautiful setting, beautiful backdrop, so many people walking around us, walking behind us, and we're talking about making sure that they're all healthy and that they're
Yes.
living healthy in a natural way. And before we jump into a lot of that, I want to talk a little bit about your story. You have a very powerful story about being classically trained and then kind of switching the way that you think about healthcare. So why don't you share that story with us today?
For me, my life started as an RN. I remained that. But when my husband passed away from cancer, I was then pushed back to go back into natural medicine. And so my education would then be another route. Because for me, it matters that people have choices to know that when you are diagnosed, your life don't have to end.
Yeah.
And so we help people to get the opportunity to live again. And so for me, Ayres has just been that transformational company that has allowed me the opportunity to help people to breathe again when life has knocked the wind out of them.
Right. So let's talk about that. And obviously, you've had a very personal experience going through both now being educated in Western medicine, but then now seeing your husband go through that process. Do you think that Western medicine has failed us in that way, or is it more just seeing that there are other options out there available to us?
I wouldn't say it has failed us. What I would say is that it has limited the options that are there. And so for me, Ayres gives me the opportunity to expand the knowledge base of my clients and other providers. Because if we know what to do, we're going to do the right thing. So when we come from Ayres, we have a 5 stance that a platform we stand on.
Yeah.
And that platform is this: if you assist yourself, your body will heal itself.
Wow.
So Western medicine, I wouldn't say it's failed. I would say it has not given us the opportunity to grow. So for us, we complement what Western medicine does. That's why at Ayres we have medical doctors, MDs that are there, but you also have me as a naturopath, and you also have other physicians, other practitioners as a part of the wellness program.
Nice. Well, let's talk about this. Let's bring it into context for everybody who's listening right now. They've gone to the doctor, traditional Western medicine, and they say, unfortunately, you've been diagnosed with XYZ. What do they traditionally do, and how does Ayres help them to, what are maybe some examples of some options that you give them to where they go, oh, you know what, my life isn't over. There are other opportunities for me.
We have clients that come in and perhaps they've been diagnosed with diabetes. Diabetes can be a debilitating disease.
Right.
But when you come to Ayres, what we do is we then coach you through the steps in wellness. That means we're going to look at your hydration, your nutrition, your supplementation. We're going to look at your stress level. Because if your stress levels are high, what's going to happen? Your body will continue to become ill. So we encourage and we enfold our clients into the process of wellness. Wellness is not just about being ill, it's about being well.
I love that. It is about
Yes.
being well, and it's about being well in all areas of your life. I love that you talk about
Yes.
nutrition, you talk about fitness, you talk about supplementation, because
Yes.
those all play a role in the way that we feel, in the way that we wake up every day, and the
Exactly.
pain that we experience or the happiness that we experience. And
Yeah,
I know that
that's
you've
true.
helped a lot of patients who have come through Ayres to walk out with a better outlook on their life and then ultimately become healthy. And I'd love it if you could maybe share a story that has touched your heart of someone who's come into the office.
We have an incredible set of clients that we've worked with over the years. The one that I call to mind is a client that came in. In fact, she came from New York, and she's now living with us in Florida. She came in, had a traumatic motor vehicle accident with living on constant pain medications.
Right.
We at Ayres was able to work with her first day to begin to break some of the stressors related to that incident in her life. Her body then began to repair itself where that patient no longer needs 24-hour of medications. The client, again, loves the process of knowing she can get back to life. She can now walk, She can now cook. She can get back to functioning like her body was meant to.
Wow.
That's what we do at
And
AIRS.
sometimes that's powerful, just those everyday exercises, just cooking
Yes.
or cleaning the house or, walking up and down the stairs without that pain anymore, and to give them that hope and to give them that part of their life back is just, it's very, very powerful. And I know there's some folks watching right now who this is new to them. They're
Yes.
used to just going to the doctor and what the doctor says, I do, right? Because he's the doctor.
Yes.
So what would you tell someone who's maybe hearing some of this for the first time, that there are other alternatives? How do you educate them, or what do you want them to know about this process to make them, trust another source? When we're taught from birth, you trust the doctor, right?
And that's what makes it so unique. If this were just from a natural standpoint and not inclusive, so often we see practitioners outside of the medical establishment that say, don't go to an MD. That's not what we do at AIRS. We have incorporated the MD along with the other modalities
Yeah.
to help define a better option. The word there is option.
Mm-hmm.
No matter what your MD or your other physicians have said, remember there's always an option, and that's what we do. We help people to find options to live in a better quality life. And for us, we found clients that their bodies have just been so fantastic
Yeah.
that they're no longer on a chemical pathway. They go to a natural approach through the foods they eat, through the water they drink. That's what we want, is options. What are your
Yeah.
choices?
I think it's empowering when you teach them this, because you're not just giving them another prescription to take. You're not just go to the pharmacy and take this. It's here's some holistic changes you can make in your life. When you go to the grocery store, make the right decisions. When you go out to eat, and all of that affects how you live on a
Yes.
day-to-day basis.
It
And so
really
you're
does.
healing them, but you're educating them at the same time.
Exactly. That's why for us, for me as a nurse, what's the first thing you do? Education.
Yeah.
It's based on
Yeah.
education. As a doctor, what's the first thing you do? Educate. In fact, the word doctor is someone that teaches.
Okay.
It's someone that educates. And so we educate our clients. The more educated I am, the better decisions I can make. And that's what we do for our clients, is to empower them to make better decisions. If you don't know that something is genetically modified, you're going to continue to eat it and
Of
get
course.
sick. But if you know what the word means, you're going to alter it.
Yeah.
Now, I'm not a rigid person in that, last night here I am, and I say, well, 80% of the time I eat wonderful. 20%, I allow myself to be whatever I want to be.
Human.
Exactly.
You're allowed to have the cookie, right? But
Exactly.
I really like that. And so now let's turn back the clock a little bit. And so when you were first getting started, when you were going through the RN process, or even maybe when you were going through the situation with your husband, what do you know now that you would love to have told yourself in that situation that I think could help some of the viewers who might be going through that right now today?
The thing that, for me, I look back, especially with my husband, it's the empowerment of the education. Because what did he love to do? He loved to consume foods that were causing acidity in his body. If I knew what I knew today, would he have been here? He might. But would we have made better choices? Yes, we would. And so for me, looking back at a younger Nicola, it would be, how soon can I begin to live the way that my body wants me to?
Yes.
When you violate your body is going to form a dis-ease. That's what it's called, disease. So it's discovering that at an earlier age.
Wow, and I know that there's a lot of folks watching right now who say, this is eye-opening. This is the information that I need. This is education that I need. And I know there's people that they want to learn about AIRS. They want to learn how Dr. Brown can help me. So for those watching right now that want to take that next step, that want to learn what you guys are doing at AIRS, what's the best place for them to learn and maybe even accept treatment from you guys?
Again, it's airsglobalinc.com, and they can reach us on Facebook, naturally. We're AIRS Global and Therapeutics, and also our 352-512-0222. We have a program that's Healthy Living with the Doctors that airs on The Source out of Central Florida, naturally. But again, they can pull that up, thesource.com, Thursday at 3:15, and they can hear some of the things that we talk about,
Wow.
about being well.
Wow, so powerful. I love the fact that you're empowering your patients, not just treating them, but empowering them to live a much better life. Dr. Brown, thank you so much for hanging out with us today on Times Square today, and I hope that you take that step to get educated and change your life. We'll be back in just a minute with more Times Square Today.